Carson.
Hi.
My name is Addison. I'm a
Nice
medical
to
device.
meet you.
Nice to meet you. I'm a medical device representative for Arthrex. I'm here to speak to you and Dr. Grady today a little bit about our tightrope ACL repair device. How are you doing today?
I'm good. How are you?
I'm doing really good. So I understand that you are a member on Dr. Grady's OR staff. What are some of your responsibilities in this role?
So I kind of just like meet with people. I've been here for a while, so I help with decisions in the procedure. So I kind of feel like I have a big part, which is great. He's like my go-to. Dr. Grady's my go-to. So I just feel like I love to see people come to me before I send them to other people.
That's amazing. So it sounds like you have a lot of responsibilities on your hands. What are some of the most exciting things you get to do in your role?
I think I love the most being able to like make decisions, just because I can kind of see where the surgery is going to go and help people in the best way I can.
Okay, that's awesome. So it sounds like you have a lot of responsibilities on your hands, and obviously you want to minimize risk for your OR team. And I understand that you're responsible for scheduling a lot of the surgeries, so you want to make sure that you can manage and execute that schedule for your staff. Yes. So I'm just here to talk to you a little bit today about our ACL tightrope device. I want to get a better feel for your current reconstruction methods for ACL repair, and just better identify your needs and convey the value to you that our ACL tightrope repair device can bring to you and your OR staff. So do you mind if I ask you a few questions to better identify your needs?
Of course not.
All right. So what type of current fixation do you and your team currently use for ACL reconstruction?
So we use a Smith & Nephew endo button.
Okay,
right now.
The endo button. All right. So I've heard lately that Prisma has been through a huge cost reduction initiative. How has this impacted your inventory with the endo button and keeping those fixed loop devices in?
It's been difficult, especially because we've had a couple of instances where people do have to come back in and we have to fix it. So that's been a little bit difficult because that takes something off the shelf that we're needing for another surgery. So that's been interesting to deal with.
Yeah, of course. And has this affected scheduling procedures at all?
Yes.
Okay, all right. So is it more difficult to schedule those procedures with that not being in stock for certain patients? All right, okay. And how much time and effort goes into sizing these implants for each patient when they come in?
A lot.
A lot, okay.
Yes.
Gotcha. So how would always having a device fit for each patient help manage and execute the schedule of your surgical staff?
It would be great.
All right. So what you shared with me today was that you've had to keep a limited amount of fixed loop devices in your inventory just due to the cost reduction initiative with Prisma. A lot of time and effort goes into sizing all of these implants for each individual patient, and that it's difficult to schedule procedures when you don't have all the items in stock that you need to do all of these operations. So I wanted to talk to you today about a little bit about our ACL tightrope repair device. So it's a one-size-fits-all device. There's no need to calculate the implant size for these, and there's no need for a large inventory because you would always have an adjustable loop device for each patient, and you wouldn't need to size. I know you've been running into that with the endo button and not having those items in stock. It would also be easier to schedule these procedures because you would always have something in stock for each patient. And there's been a couple studies coming out about the endo button loosening and patients needing to come back in after extended amounts of time for extra surgeries to get those endo buttons retightened, which I know might be a clinical outcome that Dr. Grady might be experiencing that he's not satisfied with. So I would like to show you a little demo of the product. So right here is the demo for the ACL tightrope femoral fixation. And if you look through these pages, you'll be able to see it, and I would be happy to go over these next time with you as well. I know we have a limited amount of time today.
Yes.
And there's some ordering information for Dr. Grady. But do you have any apprehensions or questions about the device for me?
No, I think that sounds great.
Okay, all right. Well, again, I just wanted to convey the value of this device to you. I really feel like it can help cut down on the time and effort that you use to size all of those individual endo buttons. You could keep a limited amount of these in stock, so it would really help reduce carrying costs. And I believe that it could really prove valuable to you and your OR team. So I would love to get a recommendation from you to meet with Dr. Grady at some time later today, just so I can convey the value of this device to him.
That would be great.
Yeah, it was so great meeting with
Nice
you.
meeting
Yes,
you.
I look forward to seeing you again. Bye. Hi, Dr. Grady. How are you doing?
I'm great. How are you?
I'm good. My name is Addison. I'm a medical device representative with Arthrex. I just spoke to Carson, but I wanted to speak to you a little bit today about our ACL tightrope repair device and just convey the value that it can bring to you and your team. So how are you doing today?
I'm good. Carson's great. I know that you got to experience that with her, so that's been I'm glad that you got to talk to her.
Yeah, she's amazing. Yeah.
Mhm.
So I see a little picture over there. Is that your family? How many kids do you have?
Yeah, I have 5.
Oh, okay, that's awesome. So I don't want to take up too much of your time today. I know it's very valuable and you could be spending it in the surgery room or treating other patients. So I just wanted to talk to you a little bit today about our ACL tightrope fixation device and get to know your current methods of reconstruction and better identify your needs. So do you mind if I ask you a couple questions and write down some notes as well?
Of course not.
Okay, all right. So my first question for you is, why do you believe that endo button, I talked to Carson before and she said that you're currently using endo button for your reconstruction method. So why do you feel this is the best solution for your patients?
Honestly, I've been using it for 5 years, and it's just kind of like I go into a surgery, I know what I'm doing. Everyone in that room knows what they're doing, and so it just is more comfortable for me instead of bringing in another device and having to learn it. If I mess up on something, having to have the device person help me, like it's just a lot. So I just always stuck with my endo button.
Okay, gotcha. Thank you for sharing that with me.
Of course.
How important is saving time to you during surgeries?
A lot. Yes.
So that's a top priority for you, would you say?
Yeah.
All right. And have you, so there's been a couple of studies come out from clinical studies saying that the endo button has been experiencing like lessened clinical outcomes in patients. They are experiencing like loosening on the device and they have to come in for further surgeries to get it retightened, which leads to longer recovery times. Is this something that you've been experiencing with your patients as well?
Yes, every once in a while.
Okay, all right. And then what are your thoughts about adjustable loop fixation for ACL repair?
I think that it can be great if it actually works.
Okay, yes. And then what are your experiences with the tightrope device? Have you heard anything about it or know any information about it?
I know a little bit about it. A couple of my other surgeon friends use it, but it hasn't been really something I've looked into just because I have always been with the endo button.
Okay, yes, of course. So thank you for sharing all of that with me. What you shared with me today was that the endo button has been slipping for you as well, or loosening, resulting in more patients needing to come back for extensive surgeries and longer recovery times. And that time is very important to you, a top priority when you're conducting surgeries, and that you're hesitant about the clinical outcomes of adjustable loop fixation. You've been with Smith & Nephew for a while and used the endo button. So I wanted to share with you a little bit today about our tightrope ACL device. So it features a proprietary locking system and post-fixation graft tensioning. This really keeps the device from slipping or from loosening. And it advances more graft into the socket than the fixed loop device, than the endo button, so it leads to shorter recovery times as well. So you wouldn't be experiencing all of the loosening and the extensive surgeries that you have to do after you've already put in the endo button. And also you shared with me that saving time is very important to you. The tightrope device has been proven to reduce time usually by like 5 to 10 minutes. And I know this is a long time for you, could be very valuable.
Yeah.
And it does this by simplifying the procedure for the staff and reducing the number of steps to load, pass, tension, and secure the graft. And I know that you mentioned that you were hesitant about the clinical outcomes of the device. So I wanted to share with you that in a 2018 study from the Department of Research and Development, it was found that the tightrope device had a significantly smaller initial elongation and the greatest pull to failure load and significant greater ultimate strength than fixed loop devices. And this included the endo button. It was included in the study as well. And that 1.5 million implants have been used in surgery worldwide in 9 years. And this alone should be a testament to the safe and effective track record of the product. And also the fact that it advances more graft into the socket than the fixed loop was found in that device, so it leads to shorter recovery times for your patients. So I would love to show you a demo of the product. So right here, there's some pictures that go along with it, and I'd be happy to leave this with you as well. So the femoral socket can be prepared in a retrograde fashion using the flip cutter drill or an antegrade fashion using the drill pin. You will mark the intraosseous length during the tunnel prep, and then you'll mark that distance on the ACL tightrope. So then from there, you will pass the blue passing suture, the white flipping suture, and the white tensioning strands together through the femur. You'll use the blue passing suture to advance the button while keeping tension on the white tensioning strands to prevent slack from forming in the tunnel. You'll pull the button through the femur and confirm the button is flipped with the white flipping suture. And then a line on the implant marked at that intraosseous length will be helpful to signal that the button has exited the femur. So then from there, you're going to hold slight tension on the tibial tails of the graft during graft advancement. You're going to pull on the tensioning strands one at a time, approximately 1 centimeter at each time. And then a mark on the graft made at the distance of the femoral socket is helpful in signaling that the graft is fully seated. So then once the graft is fully seated, you're going to pull firmly back on the graft to check for fixation. And then from there, all you have to do is fix the tibial side of the graft and you'll cut shortening strands with a closed-end tightrope suture cutter. So it really shortens the amount of time in the surgery, and it simplifies the procedure for the staff. And here are some ordering information packets. And I'm going to leave this here with you just so that you can look over this. But I wanted to ask, do you have any apprehensions about the device or any questions?
I think that just the main thing that I'm worried about is time. So I think that if I were to go into a surgery and it really could save me up to 5 to 10 minutes, it would really be something I'm interested in, just because I feel like I've been away from my family a lot. Like I said, I have 5 kids. With them, they play sports and they do other things, and I just feel like I'm missing a lot. So if I could save some time, I think that I would be really interested in this.
Okay, gotcha. So you're saying that time is a very important priority to you, and that you really want this device to work and be proven to save time.
Yes.
Okay, so the tightrope device is proven to save an average of 5 to 10 minutes, and I know that this can be very valuable to you, used to treat other patients or be there with your family and make sure you're not missing out on those important moments with your kids. It simplifies the procedure for the staff, so it would reduce the amount of time that they have to put their effort into sizing all of these different fixed loop devices, and all the time and the effort that goes into that would be eliminated as well. And there's a reduced number of steps to load, pass, tension, and secure the graft. So it really would reduce the amount of time that you would have to spend in surgery. Did that answer your concern?
Yes.
Okay.
Perfect.
All right. Yes, of course. So I just wanted to let you know that I believe that the tightrope ACL repair device can be very valuable to you and your operating room staff because of the proprietary locking system and post-fixation graft tensioning that will keep the device from being loosened and keep patients from having to come back for more surgeries. It would increase the amount or decrease the amount of recovery time that your patients are experiencing because more graft will be in the socket than with fixed loop devices. And 1.5 million implants have been conducted worldwide in 9 years. So I really feel like it shows the safe and effective track record of the product. So I'm going to leave this ordering info here with you. I would love to get these devices in stock in your OR and plan my schedule next week around all of your surgeries so I can be there with you.
Perfect. That sounds great.
Yeah, I'll leave my name and information here with you, and I'll get back to you within 24 hours about the next steps of this process.
Thank you so much.
Yeah, of course. Thank you for your time and for meeting with me today.
Of course.